strange, bizarre. And the question is, do they have sensory function? Do they have motor function? Do they have parasympathetic function? You know there are 4 cranial nerves that have parasympathetic fibers. The oculomotor, number 3. Number 7, the facial. Number 9 and 10, glossopharyngeal and vagus. So that shouldn't be anything new for you. We looked at that when we looked at the autonomic nervous system. Motor function becomes pretty straightforward. As a matter of fact, everything has motor function except for 1 and 2. Well, that's pretty straightforward. 1 and 2 are purely sensory. Vestibulocochlear is kind of interesting in that it has minimal amount of motor function. It moves some very tiny muscles in your middle ear that allow you to move some ear bones, but other than that, it's mostly hearing. But for our purposes, 1 and 2, those are pure sensory. Now, when we get to sensory function, it's all over the place. 1 and 2, 5, 7 through 10. Bang. So, go through, once again, you could print this out, you could highlight it, organize it however you want. The mnemonic that was taught by one of my former students, some say marry money, but my brother says big boobs matter more. Some being sensory, marry, money, matter more, my are mixed, and the B's are both. Excuse me. M is motor, B is both. S can go, it's 8 here, can go either way. Please remember that it has a small number. It is totally negligible, okay? But they are some motor fibers. When we talked about the parasympathetic fibers the other day, okay? So 3, 7, 9, and 10. There's a lot going on. So here's your brainstem, okay? I don't know, 7, 8 weeks ago I said this is one of those figures you should really be familiar with. In here we have lots of landmarks. We look at this, we see the thalamus, we see the cerebral peduncle, we see the pons. From the other view we would see the various pontine peduncles. We have the brains, the actual, I call it brainstem, the medulla, the pyramids, and the decussation. And if you use those landmarks, you'll be able to find a lot. Those landmarks should be really hardwired in you right now. We switch to view here. Okay, so we have the posterior view. We've got here the peduncles, the 3 peduncles that are going to connect the cerebellum to the pons. And we can see the cranial nerves where they come out, where they wrap around. This lateral view is a wonderful way to look at it. This view has become very sensitive for me because I just learned earlier this year that I have a problem right here in my brainstem, and it causes me a lot of issues. So, but here's your thalamus. We have the colliculi up here. We've got the peduncles that connect the cerebellum, which has been cut away, and the pons. We have the brainstem here. So you should be able to work through those 3 views. Okay? Print them out, cut away everything, cover it up. Label them, label them, label them. It's like, just not the phone. Well, the olfactory nerve. Number 1, cranial nerve 1. Sensory, the olfactory nerve, paired set of nerves. All of the cranial nerves are paired. You've got a left one and a right one. They come out, we've got the ethmoid bone here. The ethmoid bone is interesting in that if you really look at it, it's got some complicated structure to it. It's got, you probably remember this little bony plate that sits up in the middle called the crista galli. Crista, the crest, galli, chicken, the crest of the chicken. One of the great anatomical names. And what it does is it forms a plate that allows your two olfactory bulbs to sit to either side. And then the actual bonus so here's the crista galli. And then you have all these little foramina, the olfactory foramina, all those little tiny holes in the ethmoid bone that allow the sensory fibers to dangle through from the olfactory bulb into the nasal cavity. This tissue, these fibers and filaments, sit in a mucous membrane that's extremely secretory, so it has a lot of secretions. Olfaction is a chemical sensation. With olfaction, you have molecules that bind to receptors in the olfactory fibers that will then cause an action potential that in your brain is going to be interpreted as a scent. I don't know, some of you good at sensing different aromas? Yeah, you're one of those good people? Yeah. Years ago, there was an interesting little experiment they did in National Geographic magazine, where they sent out with the magazine, bless you, are there more?
No, we're good.
We're good?
Continue.
Cool. Sorry. A little scratch and sniff test. There were, I don't know, 7 or 8 there scratch and sniff things. And you were supposed to scratch, sniff, and answer a question about it. And the question basically had 5 components. This is a pleasant smell. The smell is okay. The smell is nothing. It's just a smell. The smell is bad, or the smell is disgusting. Well, my wife and I decided we had to both do this test. And so we each had our answer sheet, and we would scratch something and sniff it. And it was interesting because for some smells, we completely disagreed. Like one of us says, whoa, this was cool, and the other person said, oh my God, this is disgusting, I could barf. And what National Geographic was attempting to do was look at the sex differences in the interpretation of aroma. And it turns out there are massive differences in the sexes on how you interpret aromas. It is pretty amazing. Not all the aromas that you interpret are, quote, aromatic. Some of them are pheromonal. You remember the olfactory fibers go to the limbic cortex, where they are kind of interpreted limbically and then interpreted as a scent. So there's a lot going on. What else? Typical person, believe it or not, can differentiate several thousand different aromas. Believe it or not, you can differentiate many different flower scents. You can differentiate many different food scents. You have a learning curve with scent, just like with vision and hearing. So, people at the kind of upper extreme can differentiate 5, 6, 10,000 different aromas. So there's a lot going on there. I don't know what else to tell you about this. You can lose your sense of smell. Typically, when somebody loses their sense of smell, there's some form of tumor process going on in the brain. That said, my grandfather lost his sense of smell when he was relatively young. And it was interesting because as he got older, he just had no sense of smell, which meant basically he would eat anything. He always ate anything. People that have really poor sense of smell tend not to be picky eaters. People that have a spectacular sense of smell are either non-picky eaters or extremely picky. So it's kind of interesting. But smell and food taste, very, very closely associated. So, I don't know what else to tell you about the olfactory nerve. Any questions about the olfactory nerve? The optic nerve is a little more complicated. The optic nerve, so developmentally, your retina is a direct extrusion from your brain. So the retina technically is part of your brain, even though it sits in your eyes. And that's kind of interesting. The fibers from the retina, however, cross at the optic chiasm. Chiasm literally means cross. So a bunch of fibers cross, some of them go straight back. So that the fibers coming in from the retina are contralateral. Many of them are contralateral. Some of them are ipsilateral. Now what this does is interesting. All of the fibers are going to come back to the lateral geniculate. Oh, you remember the lateral geniculate. I'm very happy. You've pretty much all got the lateral geniculate right. They come back to the lateral geniculate where fiber tracts are going to do several things. Some of the fiber tracts are going to come into the midbrain area, but the majority of fiber tracts concerned with collection of visual data are going to come back to the visual cortex via the optic radiation. So what's happening here is you're getting signaling from both eyes going to both visual cortices. So here's the figure that's in your textbook that's a little shows some of the complexities involved. We're going to look at the eye, we'll look at the optic nerve, we'll look at cranial nerve 3 here and the ciliary ganglion. We'll come back to the lateral geniculi here. We've got the pretectal nucleus and Edinger-Westphal. There's a lot going on here. It's verging on obnoxiously complicated. Because when it comes to vision, essentially your eye is collecting color data. Now when you think about that, as you look out here, as you look up here, all your eye is doing is collecting color signals. Those color signals, however, have intensity involved with them. And as it turns out, there's a lot of other concepts involved, interpretive things. The interpretation is going to take place back here. What's going on? You have to interpret depth of field. You have to interpret shape. You're so used to seeing things, you don't think in terms of color anymore. As an adult, as a person who's experienced in vision, you interpret shapes and movement. Color is secondary, yet your eye is pretty much only collecting color data. So what's going on? What's happening here? Signal's coming in. So now I'm standing in front of this bright light. What do my eyes have to do when I'm standing here versus over here to accommodate the bright light? What? They have to constrict. My pupils are going to constrict. And the question is, How can that happen when my eye